Hi everyone, my name is Gina, and today we're going to be talking about starting antidepressants. We're going to look into what to expect and important things to know when starting them. So, just starting it and not sure what to expect. When you start taking them, it is a process. It does take some time for them to start working, so it is really important to be patient. But the end goal of them is to help us improve our mental well being. So ultimately, if you're wondering what the purpose of them are, is to help alleviate and make our mental well being better or improve. As we start them, we need to monitor how we are feeling to ensure that they are serving their purpose, making sure that we are progressively getting better as we take them. Here are some side effects when starting them. There's a list of common side effects: headache, nausea, upset stomach, and more. But with the common side effects, there's also the side effects that are serious and should be taken with caution and should be looking out for in case they do happen, some being suicidal thoughts, behavioral concerns, serotonin syndrome, fever, any sort of irregular body issues, anything that's out of the normal. So let's talk about how they work. They work by affecting our neurotransmitters, which help us regulate mood, behavior, and sleep. They're located in the brain, and as we know, the brain is what is in charge of telling our body what to do by sending signals. Antidepressants work by replicating our neurotransmitters. This means that they increase the chemicals that increase our mood, essentially, what helps us boost our mood. There's different types of medicines that can target different kinds of chemicals that boost our mood. Here's a list of some of the different options. Each of the different options target different mood boosting chemicals. So, what the abbreviations for with the different types of medications are labels as to what type of mood boosting chemical that the medication targets. So that's just the main category, and then there's subcategories of different kinds of medications. For example, there's different types of SSRIs and different types of SNRIs. So there's a whole different kind of medications to choose from, ultimately what is best for you. Now, with starting them, it's important that we take care of ourselves. So, some things to know when taking care of ourselves and to help with management to ensure that everything goes that we want it to. Take your medication as prescribed. This means taking the prescribed dose that your provider gave for you and make sure to take it at the same time every day. Some other things to help with self care and to recognize how the medication is improving our health. One of them being a symptom journal, such as journaling down our mood, sleep, appetite, and energy for the day, whether this is ranking it on a scale of 1 through 10 or giving a description as to why we felt that kind of way. Taking care of yourself is also really important throughout this process. So, some examples are good sleep habits, drinking lots of water, eating healthy, and exercising. Now, we talked about good things to do and what you should be doing when starting antidepressants, but let's look at what not to do or things that we should avoid. One of the first things is do not stop your medication abruptly. Stopping medication abruptly, especially without communicating with your provider, can cause withdrawal and or worsen symptoms that may already be occurring. Another one is don't mix with alcohol or drugs, as this is something that needs to be communicated with your provider first, as they need to understand what kind of medication you're taking and what kind of recreational drugs and alcohol you're combining it with to see if it's ultimately safe for you to be doing so and or what amount could possibly be safe for you to consume. Another one is don't double up on missed doses. If you were to miss your dose during the day, let's say you take your medication in the morning, you wake up, you forget to take your medication, you shouldn't take your medication twice or take it as you wouldn't. Take it normally like you would the next day. Do not double up on the dose. So when the next day comes around and you think, oh, I missed my dose from yesterday, let me take two of what I'm supposed to take at the same time I do every day because I missed my medication the other day. That is something you definitely should not do at all and definitely avoid. Now, there's some common questions and things that people want to know and ask when starting medications. I know this may be questions for some of you, and especially with it being something new, it can be kind of scary starting something new. So, there are a lot of questions, and I hope that these questions and answers help answer some of the thoughts that everyone has. One of the main ones is when will I start to feel better? Again, going back, it takes medication time for it to start working. Ultimately, 2 to 6 weeks is about roughly when the medications should start working. There's a lot of factors to it, such as the type of medication, the dosage, and the individual person itself. So maybe yourself can take medicine and it processes better than someone else, which would make sense as to why maybe the medication works faster for you than it would as maybe your friend or another acquaintance. It's honestly up to the individual's plan. Another one is will I feel worse before I feel better? Yes, sometimes this happens. If it does happen, it usually happens when you first start the medication off. If it begins to be something that you notice later on, or something that shows up after taking the medication for a few weeks, this would be something you'd want to discuss with your provider as this is not usually very common. With that, some people like to know, how do I know if it's working? And you'll know if it's working if you notice yourself feeling better, you have better sleep, more motivation, and you feel way more calmer than you would. Less worrisome is really how the medication should affect you. Another one, what time of the day should I take them? Some medications make you drowsy, maybe even make you dizzy, where some give you energy, give you motivation. Being able to talk to your provider and your provider share with you what kind of medication you're taking and what effect the medication will have on you will decide on whether it's best for you to take it in the morning or take it at night, whatever helps you most. Another one, should I take it with food? Usually, this isn't something that you need to take with food. This usually can be taken without food, as antidepressants don't really need to be absorbed like a normal kind of medicine or a different kind of medicine that you would take over the counter, as this kind of medication is to do with our hormones, our mood, our brain, and not so much the rest of our body. It's all working on our brain and how we feel. Will I lose the ability to feel different emotions? This is a common side effect that isn't rare. It does happen. It is not okay for it to be extreme or for long periods of time. If you feel that it is too much, that it's restricting your ability to feel too much, and it's continuing on for long periods of time, this would be a good time to reach out and maybe see if there's any adjustments that can be made, whether this is dosage or the times per day or week it's taken, or even the kind of medication, the brand, all different things, all different adjustments to figure out what works best for you. Now, with antidepressants, again, it's a new step, it's a big step. So let's hear about someone else's story about taking antidepressants and see how it has affected them. When I first started taking antidepressants, I was nervous, of course. This was something new and took a lot of courage out of myself to initiate the first step. I was glad I took that step. From where I am today, my mental and overall well being has improved drastically. As much as my mental health has improved, it took a lot of trial and error to find medications that were fit for me. This was challenging and frustrating for me. I felt like I wasn't going to find anything that helped me. Well, I am glad I was wrong and thankful that I kept trying and trying. Starting is the first step. It is a very good thing that you went out of your comfort zone and took the first step to helping your mental well being. It's a brave step towards improving your mental well being. You are choosing to heal and stabilize your life to make it feel more peaceful and manageable. Remember to be patient with yourself as improvement takes time, but it will happen. Reach out if needed and if reach out if you need help and celebrate the small wins. You deserve it. Each step along the way deserves to be celebrated, as again, sometimes this can be something hard, it's out of your comfort zone. So, any small achievement is good, and celebrating it helps us to be motivated to continue moving forward. Here listed is some mental health resources. This is links and websites to look into more of how medications work and more about mental health, as well as resources if there needs to be any sort of help needed outside of talking to a psychiatrist or a doctor. And then here as well, these are the websites where the information was found from. These websites include information around medication itself, as well as information around mental illnesses to learn more about them and understand ways, resources, and methods to help with all of them. Thank you for listening and thank you for learning about how it is when starting your antidepressants.